أهلا فيكم متابعينا. اليوم عندنا حلقة جديدة من برنامج شرايها عليا، واليوم معي دكتور لودي. دكتور لودي يعالج السرطان بالطب البديل بالطرق الطبيعية، ويعالج حاليا من مصح في تايلاند، وكان بيننا حوار من قبل، فاليوم عندنا حوار جديد وإن شاء الله موضوع جديد. Dr. Lodi, thank you very much for coming on the show. It's very good to have you again. I have a question. For this particular episode, I wanted to kind of go in the direction of current cancer treatments. And I'll give you an example from a recent case that I've had a conversation with. The lady had ovarian cancer, and there was talk between two doctors, which one should she go to? One of them said chemo first until we shrink the cancer, and then we remove the ovaries. And the other said the other way around. No, first we remove the ovaries and possibly the uterus, and then we do the chemo. And I couldn't help thinking, after hearing that conversation with her, that it's strange that we are living in a time where these are the only two options people are given at the moment for cancer treatment. So when you do the Hippocratic Oath as medics, there's the first do no harm, but it doesn't seem to be applied today.
Exactly. That's the tragedy of the 20th and 21st century. Around 1943 is when the medical profession actually sold out to the pharmaceutical industry, and basically most doctors are now pharmaceutical reps, pharmaceutical representatives. All protocols. Here's the thing that's, I guess, the most frustrating for me and for patients is that the doctors no longer think. They no longer take a case, consider what is the best thing to do. Rather, once they get a diagnosis, they look on their protocols and they find out the diagnosis, and there's an algorithm. If they have this, you do that. If this happens, then you do that. So it's no longer really thinking. And really, the current practice of medicine is, and I've talked to people who have been in San Francisco where they've developed computers right now. I mean, really amazing computers that are basically going to take over the function of the doctor. And I think what's going to happen is you're going to wind up having what they call mid-level practitioners, such as what they call nurse practitioners, who have gone to training beyond the nurse, and they know how to do physical exams, and they understand about pharmacology, etc. So they'll do the basic intake history, the physical exam, and then you'll plug it into the computer, and they found that the computer is something like 85% accurate, whereas when they did the same gave the same data to doctors, they were like 35-36% accurate. So the computers are more accurate in coming up with diagnoses and treatment plans that fit the protocols established. So that's the problem. So when people go for an opinion, they go for their opinion and they get it, and they go for the second opinion. The second opinion is really a second first opinion.
Yes,
because
I agree. Yeah.
These people come from the same training. It's like if I go to a BMW dealer in Riyadh or a BMW dealer in Bangkok, I'm going to get the same advice, basically. Don't buy a Mercedes. You got to get the BMW. And that's basically what it is. So yeah, one said let's do what they call pre-adjuvant therapy, which is where they give the chemo to shrink it, and their thinking is that if you can shrink it down, then the surgery will be cleaner because it won't be as muddled up. And the other one said, no, let's get it out right away. Both are overlooking so many aspects of what cancer is. They're missing the boat completely, and unfortunately, neither work. Neither.
We've kind of lost the wisdom in medicine. I mean, I've recently talked about that online, where the doctor is no longer the guru that knows about everything else. You just get one opinion, and it's even within that specialization that he has. So if you have a psychological problem associated with your cancer, then you go to the psychiatrist. You don't even get an opinion from that particular doctor.
Exactly. And see, there's the problem with medicine, the way it's practiced today. is the fragmentation of patients. You know, if you just look at the hospital, how it's divided. It's got cardiology, gastroenterology, psychiatry, urology, gynecology, as if these separate organs functioned independently. They don't. They all, I mean, if you don't have good kidneys, your heart's going to be in trouble. Your heart's not going to work if you don't have a lung, because that's the second part of the cardiac cycle. You know, so you cannot fragment. And when you do fragment patients, what happens is they feel dissociated. They're disconnected from you, and you're disconnected from them. And the cardiologist only cares about the heart. He doesn't care what's going on with your GI tract. And the truth about illness is that we are spiritual, emotional, and physical beings. And when we get sick, it's sick on all levels, and all levels must be addressed. Otherwise, we won't get well, because we're not just bodies, and that's completely overlooked. So it's tragic.
So what's happened? I mean, I don't believe that doctors intentionally want to fragment or want to not help us heal. So what happened between that person that genuinely cares, that decided to go into medicine, and on the other side of the spectrum, that same person who completely dismisses even carrot juice or any alternative method that the patient might want to think about, and goes as far possibly as calling it quack medicine? And what happened? Because that person initially started wanting to heal patients.
Mm-hmm. Yeah. In some cases, you know, a lot of people go to medical school because their father or mother did. Yes. It's tradition, it's their family, and it's not you know, I knew many when I did my internship residency in New York. There were many physicians who had gone all that way. They were now in the end of their residency, and finally admitted to themselves, this is not what I wanted to do. This is what my father wanted me to do. Yeah. And I saw one of the brightest guys I knew. Finished his internal medicine training, went into anesthesiology, and they found him one morning dead. He had injected himself. Apparently, he had been injecting some of the anesthesia, you know, to get, I guess, to get relief from what he was going through, and he died. So there's you know, that's a lot of what we see in there. And but what happens basically is, if you go in with good intentions, you go in with the intention that you really want to help people and be a healer and all that. When you go into the training is, if we look at who sponsors medical schools, it's really the pharmaceutical industry. They sponsor it, and then when you're there, they take you out to lunch, they give you gifts and all that. And the training is based on, it's a fragmented training. Like, for example, just from the very beginning, when you learn physiology, you learn the cardiovascular system. Then you learn the gastrointestinal system, and then after that, then you learn then you go back and you start all over, and you get another course which looks at the tissue structure. It's called histology, and then you go through each of those sections, and then you go through pharmacology, and then you go through pathology. Instead of saying, you know, it would make much more sense if we said, look, here's the cardiovascular system. It's connected to the lungs. It's also relies on the renal system, so basically, and the vascular system. So we can look at it as the cardiopulmonary renal vascular system. You know, it's kind of working together with the liver. So let's look at how it functions. At the same time, let's understand the histology, the basic tissue structure, and then let's look at what can go wrong with this system, and then look at some of the therapy. So that would be a more holistic perspective, but it's not done that way. So everything is fragmented, and I remember it wasn't until the end of my first year of internship that it finally all clicked. I mean, and I started to get it at that point, but I didn't get it before that time, because it's not taught in that way. And then the other thing is, in medical school and in residency, they actually say that the alternative is quackery, and that only what we do is correct because it's evidence-based medicine, is what they say. But in honestly, they haven't read the literature. There are about 40,000 published papers on vitamin C and cancer. It's there. They're just not reading it.
Yes. I mean, there's a question of time also. Most of them are pressed for time, and it's difficult for them. But, you know, the irony is, recently, most of my conversations have been happening with doctors. And I've had a few very interesting conversations with doctors who are saying that they are now slowly being convinced by, I hate to make it two sides, but it is the other side of the spectrum, which is the alternative natural route. And they tell me, A, they do not discuss it with their peers because they will be ostracized, maybe looked down upon, maybe even shunned from the industry. And another conversation, she was telling me that as a doctor, she started avoiding some of her patients because what she really wants to tell them, she is not allowed legally to say. And you're still stuck in a job where you have to say certain things, and you've spent so much time, effort, money, reaching that place, you know, in terms of degrees and effort. And it's very difficult. It's a scary place, even for a doctor at that point, to make the switch. So I'd love to hear your view on that, on somebody who was mainstream and then moved into it slowly, or how would a doctor go about that? Let's say, because I do have a lot of medics viewing this show. So how would you go about it, and how can you deal with the shock that happens to the system once you start realizing bit by bit the actual truth, where the human body is whole as it is?
Yeah, well, yes, absolutely. Unfortunately, as you just said, it has been divided. There are two sides, and if you're in the mainstream and you suggest that someone change their diet, or you suggest that they do some intravenous vitamin C while they're getting their chemo, if you suggest that, you will be, your colleagues will no longer refer to you. They will ostracize you. You will lose your standing and you will lose your career. So basically, the doctor has to decide, what did I go to school for? What do I want out of my career? Do I, you know, so I took a Hippocratic Oath, and that Hippocratic Oath was really to my patient. But what most doctors wind up doing is that Hippocratic Oath was to do no harm to themselves and their career, unfortunately, rather than to their patients. I mean, let me give you an example. I had a woman with widely disseminated non-Hodgkin's lymphoma, and she was a young single mother, and her oncologist said, I'm afraid your child is going to be an orphan, so you should try to work that out. So she came to us, because they said it was too far gone. She came to us, and within 6 months she was whole. And she went back and she showed him her PET scan. And he said, wow, that's great. And she said, you want to know what I did? And he said, no. Why would he not want to know? You know, so that makes you think, now we're in the, to me, that's mercenary. If you don't want to know, that means, you know, that means that the patient's welfare is not your number one concern. And if that, you know, then really we're in a whole different, we've got a whole different kind of doctor. So what the doctor has to do is make a decision and go for it. So what I did was I had been, I went through all the conventional training. I was in New York, Columbia University, did my residency, and then I worked 10 years as a conventional doctor, and I just came to see that we didn't help people. I mean, we put Band-Aids on things, and if someone came in with hypertension today, they had it 10 years later. But now they had side effects from the drugs, and they were sicker. We never really helped anyone. We never resolved any problem. So for me, it didn't work. That's not what I wanted to do. I said I'd rather be a farmer. You know, I'd rather do something that I can.
But surely that caused an internal struggle in you as well, to make the switch, because you also believed in what you did, I assume, when you were doing it, while you were doing it.
Right. Well, I did. I believed it, but I didn't. I believed it, and then I saw that it was a false belief, because it really doesn't work. I mean, hypertension is not a deficiency of certain drugs. You know, that which is how we would, you know, just like we think a fever is a deficiency of paracetamol. Anyway, so what I did was I made a decision, and I closed my practice, and I went around the world. I went to different places. I went to Japan. I went to Mexico, and I went all over America and in Europe, and I studied with different physicians who were on the other side, who were doing more natural and alternative therapies. And after I did that for a couple of years, and I felt that I had enough information, I went back and started my practice like that. And so I had to establish myself separated from that, and I no longer, the AMA didn't want me involved anymore. I had to leave the AMA.
Yeah, of course.
I stopped admitting patients to the hospital. I would work with other doctors who would admit them, etc. So I really had to separate. I had to see. For me, it was, I would rather not be a doctor, and you know, so that's where the doctor has to come to, unfortunately. However, let me say, much more gratifying.
Yeah, of course. I mean, you're seeing results. How would you say, if we were to wrap this up by giving some advice to doctors who are at the moment on the fence? They are mainstream doctors who are now starting to read and look into the other side, and they're kind of on the fence. Is there anything particular you would advise them to read? Any specific practitioner that you want them to follow or visit? I mean, because the medical brain still needs the science, right? So what is a good transition between being very scientific to being completely pro-nature and understanding how the body works like that?
Well, see, there's the interesting thing, because what we do is absolutely evidence-based medicine. It's scientifically proven. I've got studies for everything. So what I would advise is that for that doctor to go online and look at A4M, the American Academy of Anti-Aging Medicine. They offer fellowships in what's called functional medicine that you can do online, and start to study functional medicine, and you realize that, wow, I didn't know. It really puts together what we learned in terms of physiology and anatomy and all that stuff, and it brings in nutrition and biochemistry and puts it all together in a way that we look at healing as different. Healing is not something that you can do, it's something that you can allow the body to do, because the body is what heals. So you can take a functional medicine fellowship online, and I think 80–90% of it is online, and you only have to attend a couple times. And then I also recommend that they go to ACAM meetings, the American Academy American College, American College for the Advancement of Medicine, the American ACAM. It's kind of the AMA of the alternative. And you go to their annual meetings and go to the A4M annual meetings, and you'll hear lectures by MD, PhDs, brilliant people, all of it's science. But what they did was they came up with different conclusions because they weren't funded by pharmaceutical companies who were looking for a specific outcome. They were just looking at outcomes. So that's what, when you do that, you'll find out that there are literally tens of thousands of like-minded physicians out there all around the world who are practicing this way, and they have a different knowledge, a different database. So those are the things. A4M, you can do the fellowships, functional medicine. There's some other. There's anti-aging. There's endocrinology. There's one on integrative oncology, integrative cancer work. You can also, and then you go to ACAM meetings. You go to A4M meetings, and you go to IOICP meetings. That's the international. International Cancer Institute of International Cancer Physicians. Yeah. Anyway, Institute of Integrative Cancer Physicians. Yeah. Anyway, it's a fantastic meeting. Brilliant. I mean, like we just had the last meeting. We just had Thomas Seyfried, who wrote the book "Cancer is a Metabolic Disease." He's very well known, talking about the ketogenic diet, etc., and what they've been doing. This is hard science. He's a PhD. He's not a practitioner. So we had his lectures. So we're getting, this is hard science. This is real science, but it's not pharmaceutical science. That's the difference.
Yes.
So that's what I advise people. Once they realize, once they understand that this is more scientific, it's actually more scientific, then they'll be happy. They'll feel comfortable with making the change. They need to know that. They need to know that we're not back there doing voodoo or pendling,
That's what I hope will come out there, because I know that you're seeing a lot of results, and I know that a lot of doctors in the alternative field in general, especially for cancer, they're seeing a lot of results. So I'm hoping that this episode will maybe give them a final nudge if they're on the fence. And we need more doctors who are open-minded like that. So if you're watching this, please give us your comments below on the video. We'll be happy to answer the questions in upcoming episodes. And thank you very much, Dr. Lodi. This was fantastic. I want to ask you about your method for healing cancer, and I want to do that in a different episode. So I have a lot of questions actually for you. So we'll do that in other episodes. But for now, Thank you very much for being on the show with me, and thank you all for watching. إذا عندكم أي أسئلة حطوها تحت في التعليقات، نحاول نجاوبها في الحلقات القادمة إن شاء الله. شكرا لمتابعتكم.